So this picturing medicine drawing shows the different causes for headaches. And if we just remove the labels, we can go through these different causes together. Some of them are more common, some of them are less common, of course. If we start in the top right hand corner, we've got a plume of or cloud of smoke to remind us of carbon monoxide poisoning. Consider that in anyone who's been, for example, involved in a house fire, or they may have been exposed to carbon monoxide without realizing it in the home. So that's of course why people have carbon monoxide detectors now. This pulsating unilateral headache demonstrates a migraine. This mosquito reminds us of malaria in the returning traveller. Inflammation of the superficial temporal artery here can cause sensitivity and pain caused by the condition giant cell arteritis. These arrows remind us of a space-occupying lesion within the brain. Inflammation of the meninges, infection, typically meningitis, is what's illustrated there. This mountain reminds us that altitude can sometimes lead to headaches. Trauma or injury to the brain or head can cause a headache. The band around the forehead reminds us of the classic and common tension headache. A headache which tends to be associated with one eye or around the eye, sometimes associated with weeping from the eye, is often a reflection of what we call a cluster headache. Inflammation of the sinuses, often as a consequence of infection, typical cold, for example, can lead to a headache, and this is sinusitis, which is causing that headache. Trigeminal neuralgia, pain within the distribution of one of the divisions of the trigeminal nerve. Glaucoma can lead to a headache, and it can also cause blurred vision, and that's why it's been illustrated in this way, causing blurred vision. The first or worst headache, or a sudden blow to the back of the head, illustrated by this illustration here, demonstrates subarachnoid hemorrhage, which is a very severe and serious and life-threatening form of headache, bleeding there in the subarachnoid region of the brain. Pain can be felt as a headache when it's originating from the neck, so cervical pain can sometimes actually present as a headache. Pregnancy. Don't forget to consider in pregnancy preeclampsia, which can lead to a headache. Patients can sometimes present with a headache when they are in fact having a stroke or problems with ischemia within the brain, which can lead typically to one-sided weakness, but that doesn't always happen. Blood pressure, when it's very high, what we call malignant hypertension, can present with a headache. And then there are certain medications which can also lead to a headache as well. So if we just put the labels back again, this illustration can help you to recall all those causes of headache when you see a patient with a headache, and will help you to recall all the right questions to ask and all of the right investigations to order.